All right, we've been having a lot of fun reacting to these viral TikToks, and you guys keep sending in these medical TikTok videos. So here's part 2 of our viral TikTok reactions. Let's get into it. Okay, so tell me what you think of this one.
You do this every day? Yeah.
Oh.
Why?
Okay.
'Cause I love it.
All right. Okay, so there are some medical conditions, where the eyeballs are more forward. We call that exophthalmos or proptosis. Usually that's from a thyroid condition called Graves' disease. It can also happen if you have an infection behind the eye or a tumor behind the eye. This is something else altogether. I think this kid has trained his extraocular muscles to be able to push his eyeballs forward, and there are a few people who can do that. I don't know what else to say about this. Okay, here's the next one.
For the arm, you don't double.
Okay, this is pretty disturbing. We did these kinds of simulations in medical school. This is a mannequin where they're simulating someone who's had their leg cut off in a trauma. And that water squirting out is exactly what would be happening. That would be blood squirting out with each heartbeat from the major artery in the leg, the femoral artery. And they're showing you how important it is to apply a tourniquet. And you can see how the bleeding stops as she screws that tourniquet tighter and tighter. So if you ever see someone with a trauma like this who's bleeding, the number one thing you need to do is to stop the bleeding, and that's by applying a tourniquet before you even get them onto the ambulance.
Frostbite.
All right, this looks real. I'm not sure if this is real or not, but this is what 4th degree frostbite would look like. That tissue is dead from the skin down to the muscles, to the tendons, the bone, even the nerves, which is why it's actually often not painful. And that looks like dry gangrene, which is what we call mummified tissue. And unfortunately, there's not much you can do for that. Eventually, those fingers are just going to fall off. All right, here's the next one you guys sent. Okay, this looks really scary, but this is real. This is something called Raynaud's disease or Raynaud's phenomenon. And this is when the blood vessels to one of your extremities go into what's called vasospasm. So they completely close off and you have no blood flow. So in this case, the finger would turn white or blue. You can see that he's sort of warming it up. So this usually happens in response to cold air or cold water. And you've got to gradually warm it up to bring that blood flow back. Now in severe cases, this can actually cause ulcers of the digit because you have no oxygen to that part of the hand. And in very severe cases, it can actually cause necrosis or gangrene. But this is actually found in about 20% of the population, and for most people, they just live with it.
Breathe, buddy.
Okay, so this baby is not breathing, and that is called a breath-holding spell. This is very scary for the parent. You can see that the baby's lips and mouth are turning a little bit purplish and bluish, and that's because they're not getting any oxygen in their body.
Seriously, how long has it been?
Yeah, so this can last up to a minute, and it's usually seen in kids between 6 months and 3 or 4 years old.
Come on. Oh.
You can see that the baby did take a breath there. So what often happens after a breath-holding spell like this is, as you can see here, the baby will lose consciousness for a brief period of time. We actually don't know why this happens. It seems to be some type of natural human reaction, usually to something like fear or pain or anger. And it turns out this is benign. There's no long-term damage from this, but obviously this is very stressful for parents when this happens. All right, let's see what's next. Ooh, okay. I don't know if this is real, but that is an amazing prosthesis. Like, props to that prosthesis maker. You can't really even tell what happened there. Let's go back for a second though. Okay, that hole is actually the inside of his sinus. That's what we're actually looking at there. And yeah, that is just a really effective prosthesis. Okay, here's another video that you guys sent in that there are a lot of different versions on TikTok. All right, so you've got a wound here, and then you've got the needle going in. All right, so what this is what's called an intradermal or a subcuticular stitch. So instead of taking bites and going on the top layer of the skin, which is called the epidermis, you can see that it's a continuous stitch that actually goes in and out of the dermis, which is the underlayer of the skin. When you come out and you pull that tight, you can see that it very beautifully brings that skin together. And if you can do this, and you can only do this usually for an elliptical scar and a scar that doesn't have a lot of tension required to bring it together, you actually come out with an excellent cosmetic result with very little scarring. All right, so this is a video about bunions. You see a lot of videos on TikTok about bunions. A bunion is what happens when your first toe gets pushed towards your second. Okay, that's a really big bunion. Your first toe gets pushed towards your second toe, usually because you're wearing tight shoes or years of wearing heels, for example. and the joint between the foot and that first toe gets displaced. That's the metatarsophalangeal joint. It gets displaced outwards and forms this giant bump. And that can actually be painful. It can be quite disruptive if you're walking, but the good news is that that can be repaired with surgery. All right, here's another life hack that someone sent me.
Well, I've got another hack for you. If you get allergies, this is going to be a lifesaver. Okay, get your Vaseline stick and put a little bit onto a cotton bud and put around the end of your nose. It's going to trap the pollen particles. Thank me later.
Yeah, okay, this is not completely crazy. So in allergy season, the air is full of pollen, you breathe it in, your body reacts to it, you get allergies. So by putting a little bit of Vaseline around your nostrils on the inside, it might actually trap some of that pollen and you might do better with your allergies when you're outside. But don't use a lot of Vaseline and don't breathe in that Vaseline, because if it gets into your lungs, it can cause a very dangerous condition called lipoid pneumonia. Okay, this is a real thing. This is actually called an external cephalic version. This is what you need to do if the baby is basically the wrong way inside the uterus. So the baby should be head down in the birth canal, but if they're actually bum down or foot down, that's actually called a breech birth, and you want to avoid that. So what you can do is you can apply pressure in exactly the right spots, and you can actually turn the baby around inside the amniotic sac and get them in the right direction for delivery, and that's called the external cephalic version. Now usually it doesn't go this fast, it takes a little more time, and it only works in about half the cases, but if it does work, you can save that mother a breech birth or a cesarean section. All right, I love doing these videos. Keep sending us your medical and health-related TikToks and pop your questions in the comments down here. And for more on health and science, subscribe to the feed.